don't think there's any shortage of these guys. For those of you who have any experience with academic medicine, the halls of academia are filled with these sorts of people. The paternalistic, the controlling, the self-righteous, the arrogant doctors, nurses, managers, who absolutely believe they know better than you what you need for your health care. And their desire is to stop having you get in there, to bug them with unnecessary questions, to push them around to get care they don't need. These folks will absolutely be the new ruling class of your medical care. And they're absolutely going to go. So what do we have to do? I mean, we know the mantra. We have to defund it after we get a Republican Congress next time around. We have to work for a Republican Congress and a Republican president in 2012 and then repeal it. And then we need real health care reform. But and I have to tell you right now, although we've lost the battle for the time being, we're winning the hearts and minds of the American people. A recent poll said 63% of Americans, 63%, support the idea of repealing health care law. They know instinctively what this is about. We have 3 months. Our job is to continue to pound home the things that everybody understands, the central ideas of who we are as a people, and how it relates to this 2,000-page monstrosity. So, let's talk about the people we're fighting against. I think it's important to contrast us with them, because I'm a little sick of being called the party of no. And if you allow ourselves to be painted into a corner as being the people who lack compassion, or the party of no, who have no new ideas, as opposed to them with their compassionate, wonderful new ideas, we're going to end up losing. This is a war of ideals on the most basic level. Are we greedy as Republicans, as conservatives? Do we have a philosophy that doesn't care about the little guy, who leaves people to fight for themselves? Who are they? Are they compassionate? Is Medicaid compassionate? Do they care about the little people? Well, is the privacy of the little people important? These are the ideas that we have to separate out for everybody. Let's talk about 2 groups of people. And these are our enemies. The first group of people out there on the left side, and this is just my own way of kind of separating them out of my mind, are the anarchists. Now, they would despise being called that. These are the people who believe that we can continue doing what we're doing or double down. Everybody knows them. I mean, take a step back. The one problem we have in healthcare, and have always had in healthcare since it's been an issue, is cost. If healthcare was inexpensive, we wouldn't be sitting here talking about it. It would be cheap. But in fact, the rise of healthcare every year dramatically exceeds our increase in national wealth. Sometimes by double digits. There's years when the cost of medical care for this country goes up by 10%, and in depressions, our value as a country has gone down. But healthcare never slows down, it always goes up. We'll talk about the reason for that in a sec, but there are people out there in this group of anarchists who sincerely believe we shouldn't slow anything down, we shouldn't change what we're doing. The numbers don't mean anything to them. The fact that no matter how far you take that out, there comes a point when we go off the cliff. Numbers are numbers. At some point the numbers become so big we can't pay for it. At some point we become Greece. At some point Greece becomes Somalia. Right? I mean, really, because once you start exceeding your national wealth, you just start pulling stuff out of your pockets, right? You're putting your camera on eBay, selling the house, moving, downsizing. That's what Greece is in the process of doing. People who go to Greece know the place is in disarray. They haven't done their maintenance. The roads are falling apart. Somalia, they're stripping the copper cables off of the poles to sell for scrap because they're using up accumulated national wealth to pay for things.
Just like Detroit.
Detroit's a project. They're going to plow under whole sections of that town. So those folks, the unions, the people who want their pensions to keep going up, the people who want unending donations from the rest of us to Medicaid, Medicare programs that are failing, don't want any of it to stop, don't see any problem with the way that's working, just see it as a lack of compassion that we recognize that there's a point at which it must stop. Those folks are anarchists. By the way, they've lost. That battle is lost for them. If you go out and ask ordinary Americans now, do you think we have a cost problem in medicine? Everybody agrees, all but the complete anarchists. So they'll move on. Anytime you hear somebody say that, you simply have to say, "But look at the cost." Those are the people who say, "But everybody likes their Medicare." Sure, everybody likes free stuff. Which brings us, by the way, to the reason why we're in this cost situation in the first place. How is it possible that a country like us, a free market society, has somehow ended up in the place where our natural desires for what we consume doesn't match up with what we have to pay? How is that possible? It doesn't happen in any other realm. You don't see people buying so much food that the country's going under. You don't see people buying houses to the point, 5, 6 houses each, to the point where the country goes under. How is it possible we've ended up in a place where we're going to consume ourselves out of house and home by buying medical care that we may or may not need? Well, it's not us, it's the government. As Ronald Reagan said, the government is not the solution to our problems, it is the problem. At every step of the way in this process, the government has interfered with the natural relationship of us and our pocketbook and what we consume. Now we're at the point where it's almost completely disconnected. People on Medicaid pay nothing for their care. Zero. Not a penny. Not a penny. There was a $2 copay for some of the people in the higher echelons of the income levels that got suspended in Illinois. By the way, you all remember last election cycle when Dan Seals was giving away free gas? I mean, it goes around the corner, right? So if you put a sign up right now outside at the nearest gas station, say gas for $1, everybody in town, whether they need the gas or not, is showing up. Well, how's that any different than medical care? So Medicaid's that way. Medicare, there's some copays, some deductibles, but they certainly don't come anywhere near the actual cost of care. By the way, the government interfered with how you get your employer health care. Back in the 40s, when they put, another bright idea, wage controls during World War II, employers needed something to attract workers. They said, how about you let us give them health care as a benefit? And that's how that, well, sure, you can have as a tax-deductible benefit that you can give your employees health care insurance. Well, the problem is that's another disconnect. So even though my employees are paying for their own care, they don't think they are, because they're not paying for it, I'm paying for it, right? The fact that they don't get a raise, that they don't have as much income coming into their pocket, that doesn't register at the moment. All they see is that they get this great healthcare policy and it's not having to be paid for by them on the spot. The fact that they're not getting it in the form of a paycheck from me doesn't matter to them, because that's not how the human brain works. So now the difference is if you go and buy your own insurance on the open market, which I do, I want the highest deductible possible. If your employer is buying it for you, you want the lowest deductible possible. And the highest lifetime limit, and the lowest copay, and the smallest number that you have to pay for drugs when you use your drug card, right? You want dental and eyes, and all those things your employer is buying for you. The employer's not buying anything for you, he's just not giving you your raise. So now on every level we're disconnected with the cost of our care. And then our government is surprised when we overconsume. This brings us to the second group, the group that Donald Berwick is in, as far as our enemies go. And believe me, they are our enemies. These folks are actual pragmatists. If you have a chance, I encourage you to go on YouTube and type in Donald Berwick. I've watched hours of this video. He's an entirely reasonable man. And I actually believe that what he says is that he's trying to be compassionate. From the standpoint of these folks, they recognize the cost problem we face. Again, I don't know what the date is, nobody does, but if we do things exactly the way we're doing it now, at some point comes economic collapse. The numbers don't give us any choice. It's simple math. They don't want that day to come any more than those of us sitting in this room do. They recognize that something has to change. What they see as the problem is the individual. The choices that we make on a day-to-day basis. Look what Americans are doing. Look what they're consuming. Look what people on Medicare are doing to that program. We have to fix it. We have to stop it. And so what do they say? Let's get control of the system. All the decisions that you all make, the MRI for your knee, the more expensive drug, the physical therapy, the home therapy, the hospice, whatever it is, all of you are making personal choices that are too expensive. They don't recognize that the government has put you in a position of doing that. They simply want control of the situation. And so, what they've said is, let's do it in as compassionate a way as possible. Let's make sure everybody gets access to care in the exact same way possible. Let's make sure that nobody can have things that other people can't have. From their standpoint, they're being compassionate. But what's the problem with that? The problem with what they're talking about is that it is fundamentally inconsistent, A, with an American way of life, and B, with an idea that we want to lead towards prosperity. We want to move towards prosperity.